Good evening. I am State Senator LaTanya Johnson. I represent Milwaukee's North and Northwest Side, located in the 6th Senate District. I am so honored to have you here with me today as we dive into um, a lot of the disparities affecting our Black community. And we hope that the information that's being shared today will help you to better understand the Black plight here in Wisconsin, because we know for far too long that our Black and Indigenous people of color and communities have been left behind, intentionally harmed by policies and systems that are in place that were not designed for us. In order for us to move forward, we must know the current landscape so you can better understand, but better prepare yourself to participate in whatever you can do to make things better for our Black communities and also our communities of color in general. So we hope that this not only educates you, but it equips stakeholders with some of the tools needed to advance for change and advocate for change. Much of the data that we'll be discussing today came up during our state budget process. I'm a member of the Joint Finance Committee, and we determine where the dollars will be spent in Wisconsin. But in order for us to do that, we're given informational pieces on each department, and from that, we're able to make choices. And some of the information that I read during those department briefings, it was very upsetting to me. So I wanted to make sure that I shared that information with the general community so you would have all of the information that you needed to do effective advocacy. So now we're going to get started on the presentation. 2020, Wisconsin had roughly 4,515 people sleeping in places not meant for human habitation. So that included places such as cars, sidewalks, benches, parking garages. In 2020, a total of 11,624 people stayed in emergency shelters in the state of Wisconsin. Of these, 4,866 were located in Brown, Dane, and Milwaukee counties, while 6,758 were located in other parts of the state. In 2018 through 2019, 18,349 children attending Wisconsin public schools lacked a fixed, regular, and adequate nighttime residence. That means that these babies were essentially homeless. Now, demand for housing in Wisconsin is greater than the supply available. So that leads to a lot of problems right off the top. But it also leads to higher rents and shortages of affordable housing. Wisconsin's housing shortage disproportionately affects our lowest income households. Wisconsin has an estimated 188,100 individuals who earn less than 30% of the median income. Now, 30% of the median income for a family of four would be roughly $24,600. So that means that 188,100 households earns less than the $24,600 that's considered 30% for a family of four. With that being said, there are only 69,000 homes in the entire state that are considered affordable for those families. So we can see roughly just from that information why homelessness is such an issue in Wisconsin, why evictions are such an issue in Wisconsin. But also there's a factor of predatory landlords that take advantage of our low-income families, especially in the city of Milwaukee, where you find families being forced because of evictions on their records to take dilapidated housing because you have landlords that are willing to rent without background checks. And in most cases, those inadequate housing pieces are lead infested. They're not safe environments for our children. But more importantly, the rents are so high that those families will soon face eviction. Now, Black Wisconsinites are 11 times more likely to experience homelessness than their white counterparts. According to the 2021 point in time count, 58% of homeless Milwaukeeans were Black, despite African Americans making up just 38.7% of the city's total population. In contrast, 36.9% of homeless people in Milwaukee are white, yet white Americans account for 44.4% of the city's entire population. Next slide. Now, the Department of, we're now going into the criminal justice portion. And here we're going to talk about the Department of Corrections. The Department of Corrections operates 36 adult correctional facilities, which includes 20 correctional institutions and 16 correctional centers. Corrections also uses prison contract beds for state inmates housed in county jails and federal facilities. The Department of Corrections also houses inmates at the Department of Health Services Wisconsin Resource Center, also known as WRC. The facility is used for inmates in need of specialized mental health treatment. The Department of Correction also offers career and technical education and vocational training as well in 17 different institutions across 24 different areas. Next slide. Now, the average daily population in Wisconsin adult prisons as of May 21st, 2021 was 19,384. That was roughly 18,000 males, 1,200 females. And this included institutions, centers, and state inmates admitted to and serving time in contracted beds as well. This was down from the normal 23,000, roughly 600 inmates that's normally served on a daily average in 2019 and 2020. This was the first time decrease since 2011 and the 2012 year period. This decrease was due to the public health emergency known as COVID-19. The emergency order number 9, issued on March 23, 2020, placed a moratorium or hold on admission to state prisons and juvenile facilities until June 1st, 2020. This hold placed on prisons and juvenile detention facilities attributed to the significant decrease in the prison population. The Department of Correction prior to COVID was admitting roughly 160 inmates per month. Currently, that number holds to just 110 per month. Next slide. Wisconsin imprisons Black residents at a higher rate than any other state in the country, at a rate of 1 in 36 Black adults. And I'll repeat that. Wisconsin imprisons Black residents at a higher rate than any other state in the country, at a rate of 1 in 36 Black adults. Black individuals comprise 41.3% of Wisconsin's prison population, but just 7% of the state's population, and are imprisoned 12 times the rate of white Wisconsinites. And I'll repeat that again because I think that's really important. The Black individuals comprise 41.3% of Wisconsin's prison population, but just 7% of the state's population, and are imprisoned 12 times the rate of white Wisconsinites. There are currently 19,865 individuals in the care of the Wisconsin Department of Corrections. Approximately 8,204 individuals are Black. A 2020 study by the Wisconsin court system found that men of color, particularly Black and Native American men, are significantly more likely to receive prison sentences than their white counterparts. For example, 28% of African American men are more likely to receive a prison sentence, and 34% of Native American men are more likely to receive prison sentences. Respectively, with white men 21% less likely than non-white men to receive prison sentences. Next slide. Now we're going to talk about Oak Hill Correctional Institution Assistant Needs Facility for Males. I'm going to be honest about this one. I have a hard time understanding why this facility is so necessary and in need of so many beds. I understand if an individual was sentenced at a much earlier age, say, over 60, or sentenced with debilitating conditions. But if that individual is in prison serving time and they've gotten to the place where they need assistance with daily living and skills, I don't understand why compassionate release shouldn't be a part of this narrative. Those are just my opinions, and I thought I'd share those with you, and now I'll go into the slide. In 2017, Act 59, Corrections was approved for $7 million of borrowing to build a geriatric facility, which would provide 65 bed barracks, bunk-style housing units with 15 hospital beds and 50 standard beds. They will provide limited medical services for male inmates needing assistance with daily living activities. Now, this facility is being created to address the rising number of inmates that need medical resources due to poor physical health, diminishing cognitive ability, and lack of mobility. Basically, any impairments that would prevent an inmate from functioning completely independent. Now, the institution population has a high geriatric population with 7.7% of male inmates and 4.2% of female inmates being 60 years of age or older as of July 1st, 2020. Because of this factor, the new facility is expected to fill these 65 beds almost immediately upon opening their doors and upon completion. Again, this is something that I sincerely don't understand, because the one thing that we know is that when these individuals are in our jail systems requiring specialized care, the state foots that bill. Your tax dollars foots that bill at 100% of the cost. But if those individuals are outside of the prison system, they qualify then most for Medicaid, which means that the federal government pays for 60% of the cost and the state government pays for 40%. It's a matter of cost savings. It's cheaper. And if these individuals are, diminishing cognitive ability and poor physical health, the question then remains, why are they still being incarcerated? That's my own 2 cents. Next slide. Now we'll talk about our mental health facilities. Wisconsin Department of Health Services runs 2 mental health facilities, Mendota Mental Health Institute in Madison and Winnebago Mental Health Institute in Oshkosh. Mendota Mental Health Institute is typically almost always used for individuals who have been committed as a result of criminal proceedings. These individuals are known as forensic patients, and they do have a unit at Mendota for civil patients too. Now, what we mean by forensic patients, this falls into one of 3 categories. Individuals found not guilty of a crime by reason of mental disease or defect, individuals who have been deemed not competent to stand trial for a criminal charge as a result of mental illness, and for whom the court has ordered treatment to restore mental capacity. This is key because you have so many individuals that are finding themselves in jail or incarcerated, and some of these individuals are sent to Mendota. Mendota is designed to help these individuals restore, if possible, to their mental competency, so they can then stand trial. So just because you have a mental disability doesn't necessarily mean that you are going to be able to commit a crime and not have any penalties. That's one of the reasons that we see so many of our prisons filled with individuals who we know have mental health disabilities. Number three, individuals who are undergoing evaluation to determine competency to stand trial. Next slide. Okay, I'm having problems turning my page. I got so many papers in front of me, but here we go. So DHS operates Mendota Juvenile Treatment Center too, also known as MJTC. This is located on the Mendota campus. The Juvenile Treatment Center is a Type 1 facility that provides psychiatric evaluations and treatments for male juveniles transferred from the juvenile correctional facility whose behavior is extremely disruptive and they haven't responded well to the standard services of treatments that were being provided. So MJTC has staffed 29 beds since 2016. The department has operated a 14-bed unit for forensic adults within the MJCT building in a separate space that's not being used by the juvenile program. Now, we'll talk about Winnebago Mental Health Institute. Winnebago Mental Health Institute typically deals with patients who are admitted under a civil process who have been deemed a danger either to themselves or to others as a result of mental illness or drug addiction. This can be done on an emergency basis, a time-limited basis under an emergency detention order, or long-term basis known as civil commitment. The state also has Sand Ridge Secure Treatment Center, also known as SRSTC. Now, this is located in Mauston, and I know I'm probably pronouncing that wrong, so forgive me. This facility houses our state's civil commitment program for sexually violent persons. But since 2018, the department has also operated units for the forensic patients at Sand Ridge, using those spaces not needed for the sexually violent persons program. The department has 2 units with 40 beds for forensic patients who would otherwise be waiting for admission to Mendota. That is a serious issue. Mendota does have a waiting list from each of the 72 counties from what we were told in the past. So, but if you count all of the beds, including the 14 beds in MJTC, the 40 beds at Sand Ridge, Mendota has the total capacity of 313 beds for forensic patients. So that in itself says that there are a lot of individuals with mental health disabilities that are being dealt with in our prison systems as well as in our mental health facilities. Now, we've talked about some of the issues concerning our criminal justice system. Let's talk about some of the proposals that the governor tried to propose in order to help alleviate some of those issues and make our criminal justice system better. First, we'll talk about raise the age for adult corrections. Right now, currently, the age for adult confinement is 17 years old. The governor wanted to raise that back to 18 years old. It doesn't matter what an individual has been charged with. If they are 17, they are going to be charged as an adult. That's something that we need to change. It was included in the governor's proposal, but my Republican colleagues pulled that out. Create a community reinvestment fund from tax revenue generated by legalizing marijuana. This is big. A lot of people want to see marijuana legalized. Legalizing marijuana in the state of Wisconsin would have generated an estimated $80 million to fund equity grants across state governments and in communities disproportionately impacted by the war on drugs, also known as our Black and Brown communities or our BIPOC communities. That too was pulled out by my Republican colleagues. Earned release program expansion, and what that is the governor wanted to invest $4.1 million and 33 treatment specialist positions to expand treatment capacity in earned release programs in substance use disorder programming. That too was deleted by my Republican colleagues. Alternatives to revocation expansion would have provided $3.1 million to expand available options for residential community alternatives to revocation by 50 additional beds, and that too was pulled out. Earned release compliance credit established the earned release compliance credit to require a person with qualifying offense upon revocation or extended supervision of parole to be given credit toward the service of his or her sentence for each day the person spent on extended supervision or parole without violating the condition of or rule of extended supervision or parole. And that was so extremely important because so many times you see individuals with these long, lengthy prison sentences, and then outside of those prison sentences, they may get an additional 15 or more so years on extended supervision, which just gives them more time and more opportunity to violate their conditions of parole and be revocated. And some people may think, well, if you're on probation or parole, you shouldn't do anything to get yourself revoked. But some of those things can be as simple as, you know, maybe all of their relatives live on the north side, but so are all of their offenses located on the north side. A portion of their condition of release could be to not be on the north side or to not be with anyone that's a convicted felon. You know, those things are difficult, especially at the rate that Wisconsin incarcerates so many of our African American individuals. Knowing somebody that isn't on paper is becoming more and more challenging. So making sure that we do whatever's necessary to at least give those individual credit for the days that they spent without revocation is extremely important, because we don't need that time started over and putting them on paper even longer. Now, reduction of mandatory minimum sentences is also extremely important. We all know that in most cases, mandatory minimum sentences does not work except for violent offenses. If individuals are committing violence offenses and they are committing numerous violence offenses, the only way to compensate for that is to pull that individual off the streets and to give them time. So there are some instances where the mandatory minimum sentences do work, but allowing a sentencing court to reduce the term of confinement below those applicable mandatory minimum sentences for individuals that are not serving time for violent offenses, and giving them an opportunity for earned release programs, or giving opportunities for extraordinary health condition provisions, also would help to serve those purposes too. Next slide. Personal safety. This is extremely, extremely important. I know in Milwaukee, we are extremely challenged with personal safety, and it is on the top of everyone's mind and the number one issue that most people feel need to be resolved. So every year, an average of 177 people in Wisconsin die by gun homicides, and 509 are wounded by gun assaults. A rate of 3.3 homicides and 8.8 assaults per 100,000 people. Wisconsin has the 33rd highest rate of gun homicides and gun assaults in the U.S. In Wisconsin, 74% of all homicides involve a gun, compared to 75% nationwide. Gun homicides, assaults, and shootings by police cost Wisconsin $1.3 billion each year. Wisconsin has the 32nd highest cost of gun homicides, assaults, injuries, and shootings by police in the U.S. at a rate of $233 per person. I'm sorry, that may not be dollars per person. It may be in terms of million. In 2020, Milwaukee police confiscated more than 3,000 guns last year during traffic stops and domestic dispute calls, an 18% increase from 2019. Unfortunately, 2021, the worst year for gun violence in decades, surpassing even the highest levels last year. There were 201 homicides in Milwaukee last year, surpassing the record for 2020 of 190 homicides. And also 90% of the homicides were shootings. There have been 25 homicides thus far this year. And in 2021, there were 858 non-fatal shootings in Milwaukee. 94% of those shootings were shooting victims were Black. The non-fatal shooting piece. So we have all become accustomed to watching the news and seeing shooting victims being classified as non-fatal shootings or non-life-threatening injuries. Just because something isn't non-life-threatening doesn't mean that that individual is okay. We're finding more and more that these individuals have lifelong debilitating injuries, and that too costs taxpayers money with SSI payments, loss of income, hospitalization, because the majority of these individuals do not have insurance. They're either on Medicaid or uninsured, so that's an additional cost for both the state and the hospital. But also the family costs, associated with having to deal with or care for a gunshot victim. And that's increasingly more concerning. Frederick Hospital is one of the level 1 trauma centers that we have in the state. Typically, if it's a gunshot victim, they have approximately 1 hour to get that patient stabilized and to Frederick if we're going to be able to save their lives. Frederick's doctors have told us that they have become so skilled with being able to trace exactly where those bullets have gone and what damage they have encountered to go back and repair those injuries. And just because those injuries are repaired doesn't mean that that individual goes back to normal. So those are also issues. We're also seeing issues with decreased property values. Places like Zillow are listing crime aspects when they show their listing. And, if you are an individual and you are looking for a house and you look on that crime spotter and you see shot spotter, more than likely you're going to look somewhere else, and that's an issue. We've even had individuals from, our Realtors Association tell us that some realtors will not sell in Milwaukee, and that's an issue. Because if you're a home seller, you want as many people as possible to see your property so you can get the most dollar or bang for your buck. And also for African Americans, most of us, the largest purchase that we will ever make is our home. It's the investment in our home. And if our homes are our key to Black wealth, and those homes, the values are decreasing because of crime, then that's another issue too that needs to be addressed, because then that affects Black wealth. In Madison, between 2019 and 2020, shot fired incidents also increased from 144 to 250. Homicides almost tripled from 4 to 11 in Madison. Also, some of the information that we gathered, just particularly to some of the neighborhoods that I represent, For example, Sherman Park had 64 shootings per square mile. Metcalf Park had 66 shootings per square mile. Walnut Hill, 63, and North Division had 62. Next slide. In 2019, a Black resident in Milwaukee was 8 times as likely as a white resident to be shot and killed. African American children in Wisconsin were 42% more likely to die from guns than African American children in any other state. And I will repeat that. African American children in Wisconsin were 42% more likely to die from guns than African American children in Milwaukee. Children under 17 accounted for 137 homicides and non-fatal shooting victims in 2021. So children under 17, that was 137, both homicide and non-fatal shooting victims in 2021. So far in 2022, that number has been 5. And we all know that Milwaukee can be an exceptionally difficult place for adults, but it can be an exceptionally cool place for our African American babies. And we all know that Wisconsin is ranked one of the worst places to raise an African American child, and gun violence also plays a part of that. Prior to coming on here to do this, I was watching the sentencing for Antonio Bratcher, who was found guilty of killing 3-year-old Brooklyn Harris. She was a 3-year-old baby that was killed in a road rage incident. So we do know without a fact that our babies are dying from gun violence, and we have to do more to not only protect our communities and ourselves, but also our children that are playing on our Milwaukee streets and taking those streets to school as well. Next slide. Now, for the personal safety aspect, the governor did put dollars aside in the budget proposal to address personal safety. He put $4 million in to create a civil legal assistance grant program. And basically that program provides legal assistance to low-income individuals relating to eviction, unemployment, compensation, consumer law, domestic violence, and health insurance matters. That was pulled out of the budget. He also set aside $20 million for after-school programs to help keep kids safe and engaged and to give them something to do. That too was pulled out of the budget. Universal background checks for firearm sales, that is huge, especially in the city of Milwaukee, where we know that there are so many guns on the streets in the hands of wrong individuals. If you are a convicted felon, and we've heard individuals do this, go into armslist.com to buy a gun. You know, those private sales are desperately in need of universal background checks and making sure that those individuals who are purchasing guns are actually meant to have them. Now, there were some standalone bills that were introduced that were designed to help personal safety as well, too. One bill was SB 330, and I was an author of that bill. And it allowed the Attorney General to investigate civil rights violations by local police departments. Right now, when there is an issue, those individuals have to sue individually or hire a lawyer to benefit their best interests. This bill would allow the Attorney General to investigate those civil rights violations by local police departments. Of course, that bill has never received a hearing, and it's not going to receive a hearing before the session is over, either because of the makeup of the state legislature. Safe harbor for child trafficking victims, that did pass the Senate committee, but so far it's at a standstill. And that is a safe harbor for children who have been found to be victims of human trafficking, not charging anyone under the age of 18 with prostitution, basically, because those children are not young enough or not old enough to legally give consent. Safe roads save lives. I was also a lead author on this legislation as well. And basically, we know that vehicle crashes, especially in Milwaukee, and reckless driving it's just an epidemic. According to the Marquette University Law School, traffic-related deaths in the city has seen a 65% increase since 2011. And even with increased traffic patrols, diversion techniques, police and city leaders still seek additional help to help curb the widespread instances of reckless driving. Basically, what that bill would do, it would allow a first-class city, presently only Milwaukee, to use an automated speed enforcement system to identify speed limit violations and allow the leadership of a first-class city to enact an ordinance that permits the use of traffic control photographic systems on highways under the jurisdiction of the city to identify traffic signal violations with speed limit. That is something that I'm adamant about because we have all heard of the reckless driving fatalities and injuries, and it's something that definitely needs to get